Hello everyone, now let us discuss about HIPAA Act, Health Insurance Portability and Accountability Act. The Health Insurance Portability and Accountability Act, which is also called as HIPAA, is a federal law that is adopted as United States legislation that offers data privacy and security protections for protecting the medical information. On August 21st, 1996, President Bill Clinton signed the federal law. The HIPAA overrules state laws governing the security of medical information, except when state law was judged harsher than HIPAA. This act is important legislation in the United States healthcare business. It controls the privacy and security of health information. And the government agency that is in charge of developing the rules for implementation of this act is United States Department of Health and Human Services. HSS, United States Department of Health and Human Services. In other words, the goal of this act is to safeguard the patient's personal data from public access. The aim of this act is to help in the prevention of patients' information from being misused. And the act has been amended several times since it was first enacted. The following are the HIPAA objectives: privacy of health information, security of electronic records, administrative simplicity, and insurance portability. The diagnosis, treatment information, medical test results, and the prescription information, as well as national identification numbers and demographic information such as birth dates, genders, ethnicity, and contact information are considered to be protected health information under the HIPAA Act. These above mentioned points are considered as protected health information under the HIPAA Act. What are they? Diagnosis, treatment information, medical test records or results, prescription information, as well as national identification numbers, demographic information such as birthdays, gender, ethnicity, contact information. This act preserves the confidentiality, integrity, and the availability of protected health information (PHI). It also establishes restrictions on the PHI disclosures. If any HIPAA provisions are violated, the violators will face financial penalties. This act is also punishable by criminal penalties, and it is not valid defense to claim ignorance of the HIPAA breaches. Coming to the history of HIPAA, the Health Insurance Portability and Accountability Act was enacted by Congress in 1996. HIPAA is a medical privacy and security law that many people are aware of. However, HIPAA's first goal was to set standards for transferring electronic health data and to enable people to transfer and maintain health insurance after changing or losing their jobs. HIPAA did not have national privacy protections for medical information until 2003. HIPAA did not have national privacy protections for medical information until 2003. All of the safeguards were based on the state laws. And the HIPAA privacy rule, HIPAA security rule, and HIPAA enforcement rule were issued and enacted by the US Department of Health and Human Services. Under HIPAA, the Department of Health and Human Services released the first national data privacy and security rules in 2003. Under HIPAA, the Department of Health and Human Services released the first national data privacy and security rules in 2003. The security rule establishes guidelines for protecting electronic PHI, and individuals have right to their protected health information under the privacy regulation information. It explains how the entities covered by HIPAA can be used and disclose, how they can use and disclose the protected health information. The compliance, investigations, and possible punishments for infringement of the HIPAA privacy and security rules may be addressed by the enforcement rule. The HIPAA regulations are enforced by the Office for Civil Rights (OCR). HIPAA regulations are enforced by the Office for Civil Rights, which is a part of Department of Health and Human Services. And in 2009, the President Barack Obama signed the Health Information Technology for Economic and Clinical Health. Health Information Technology for Economic and Clinical Health HITECH Act into law. The HITECH Act is a part of American Recovery and Reinvestment Act. HITECH Act is a part of AARA, American Recovery and Reinvestment Act under Title 13. Medical privacy. Medical privacy under control between 2003 and 2009. The electronic medical records have begun to take place of paper records since the HITECH Act. The patients began to communicate with their doctors through emails and internet portals. Prescriptions are now being processed electronically at pharmacies. The HITECH Act provided financial incentives for health providers and insurers to continue transferring to electronic medical records. It also addressed the privacy and security concerns associated with the electronic transfer of health information, such as unauthorized access and data breaches. The HIPAA Omnibus Rule was released by the HSS Office for Civil Rights in 2013. The HIPAA privacy, security and enforcement rules were significantly altered by Omnibus Rule. Many parts of HITECH Act have been implemented. The breach notification rule was modified and finalized. It also included modifications to HIPAA privacy rule that were enforced by Genetic Information Non-Discrimination Act of 2008, GINA, Genetic Information Non-Discrimination Act of 2008. Coming to the purpose of HIPAA, in 1996, the Act was first introduced. The law allows employees to keep their health insurance coverage even while they are between jobs. The Health Insurance Portability and Accountability Act, HIPAA, covers specific types of health information and not only health information. Examples of specific types of health information or records containing health information are genetic information. Health information in school records is identifiable information about individuals maintained by federal government. Certain alcohol and drug substance abuse records, information relating to medical research, all these things. And because HIPAA establishes a set of criteria for which states might develop or create stricter regulations to safeguard health information, it also covers states that may adopt their own laws to protect health information. The law also obliged health organizations to set up procedures to protect patient data in order to prevent healthcare fraud. But the rules for doing so took years to complete. HIPAA also established numerous new standards to increase healthcare efficiency, encouraging healthcare organizations to adopt the standards in order to decrease the paperwork. And HIPAA was necessary to employ code sets in connections with patient identities in order to facilitate the effective movement of healthcare data between healthcare organizations and insurers, as well as to streamline the eligibility checks, billing, payments, and other healthcare activities. The Act also prohibits interest on the life insurance loans from being deducted from taxes, establishes group health insurance obligations, and standardizes the amount that can be saved in a pre-tax medical saving account. The Health Insurance Portability and Accountability Act is also known as Public Law 104 and 191. Its main objective is to guarantee continuous health insurance coverage to people who leave or change employment. The Act must also reduce the cost of health care in long run by establishing a standard for the electronic transmission of administrative and financial processes. Tackling misuse, fraud and waste in health insurance and healthcare delivery, as well as enhancing the access to long-term care services and health insurance are among the other objectives. Coming to the components of HIPAA. HIPAA is divided into 5 sections or titles. HIPAA, first one is, title 1 is HIPAA Health Insurance Reform. Individuals who leave or change employment have their health insurance coverage protected under Title 1. It also makes it illegal for group health plans to refuse coverage to anyone who loses or changes employment. It also forbids corporate health plans from denying coverage to people with certain diseases or previous conditions, as well as imposing lifetime coverage limitations. Coming to Title 2, the Title 2 requires the US Department of Health and Human Services (HSS) to develop national standards for processing of electronic healthcare transactions. It also requires that healthcare organizations maintain highly secure access to patient data and comply with HSS privacy laws. Next, Title 3. Title 3 deals with HIPAA tax-related health provisions. The Title 3 contains tax rules as well as medical care guidelines. Title 4 goes into further detail on healthcare reforms, including provisions for those with pre-existing conditions and those who want to keep their coverage. Title 4 mainly deals with application and enforcement of group health plan requirements. And finally, Title 5, it deals with revenue offsets. The Title 5 contains rules on company-owned life insurance and the income tax status of the persons who renounce their US citizenship. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.